We would like to discuss today about repair cases. On the routine basis, we do a transplant, but what is this repair cases? Usually, most of the patients would require second and third session to get the more density. That's not the repair, but a repair case means someone who has underwent a transplant and the outcome will be disastrous, plan will be wrong. That's called the repair cases. That kind of case we're going to discuss today. Well, what are the main reasons for repair cases I would like to discuss today? Well, any best surgeon, I'm sure there will be failures in surgery, but repair case, usually the plan itself will be wrong. The plan, execution of the plan itself will be wrong. That's what usually the outcome will be very disastrous. So here number one reason is most of the patients would always wanted the hairline in the frontal area, and they opt for transplantation age less than 25. With having very less maturity, they'll end up in going for the transplantation with amateur doctors or clinics. They end up in a bad outcome. That's the one reason. Number two, few doctors or quacks who does the transplantation also would not recommend that you should not go with the transplantation in this area, because they don't give enough information to the patient about the hairline and outcomes, whatever it is. So that is the second reason. That means the wrong design or wrong plan would lead to repair cases. These are the major reason. Another reason is, at times, even you try to explain to the patient about the outcome, still they would want to get the hairline the way they want it. Usually that ends up in a disastrous outcome. So, well, our suggestion is like always better to talk to an expert surgeon who is going to have an experience and is going to tell you what kind of hairlines is going to be suitable to you, and accordingly you should go to the transplantation. If you just want to implant everywhere, wherever you want hair, I'm sure you're going to end up in a disastrous outcome. That's what we are going to discuss today. Well, there are many other reasons why repair cases will come to us, and we are not going in details about those things in this video. We would like to discuss such repair patient and correction today. This gentleman aged 32 years underwent transplant in a different clinic 2 years back, ended up in a disastrous outcome. This is not a redoing surgery, this is a repair case. I mean, spoiled surgery. Why this case is spoiled is that we already discussed a few points about why one patient will get a disastrous outcome or a repair. This case actually, someone has planned 2 centimeters below the hairline, which is not recommended at all, because there are a few calculations on the face, because each area, when you try to implant the grafts, angulations will change. Accordingly, we need to take a few reference points and design the hairline. So here what happens is just they implanted 2 centimeters down, which are the hairline supposed to be below that 2 centimeters down, they implanted, and that went very disastrous outcome. You can see how the outcome has appeared after transplantation and how it's not natural looking at all. It is awkward looking. That's called the repair patient. In this case, we are going to correct this patient by removing few grafts and reimplanting in the mid scalp. Well, when we spoke to the patient about his past experience, then he has no idea what going to be. What kind of design the hairline, what kind of plan they're executing. He has no idea. He had no idea. Now, this is a very important point to be discussed, because when we come to the consultation, your doctor, your surgeon, when they see at your scalp, what is the plan did he advise you? Is he going to show you the markings or not? And the day of the procedure also, is he going to show you markings, which is by visuals, by looking at the mirror, and even at the measuring the measurements with few reference points? All this make sure we're going to get a beautiful natural design. That design we're going to market before surgery. This is a very important point. Patient should understand it. Without doing all these markings and explanation, directly surgery we cannot do, because while doing the surgery we will lose the reference point. So before consultation or during consultation or before surgery, we're going to have all this, everything is clear, and we'll show to the patient. That is a very important step in the hair transplantation design. So this patient experience was, he had no idea what kind of hairline they were designing. That's what happened to him. Well, we'll get into details about this case. Each repair patient has different corrections plans, and whatever the patient has his own plans, the surgeon has to have some plans to correct it. Before correction, we need to check whether donor is still available or not. Most of the cases, the repair cases, our observation is donor will be badly harvested and badly depleted. You can't even get any more hair in such patient. That's another disastrous things we'll understand. Most of the time patient will look for the implanted hair and density, but he never bothered to look in the back because he cannot see himself. When they come for the consultation for second correction, whatever it is, when we see their donor is badly managed and there is no more hair has to be taken. So well, this patient luckily has enough donor to take second session. So now the plan for this patient is, each patient plan is totally different. This patient plan, what we observed and what we planned is, we need to remove this frontal plugs which are placed unnecessarily. That's the most important point in this patient. Even patient also wants that. So we need to remove it and recorrect the hairline, as well as get the more density in the frontal hairline, mid scalp, some grafts in the crown area. This was the plan we wanted to execute in this patient, and let's see what kind of difficulties we faced during the procedure. Well, when we speak about removal of the grafts, it sounds very simple for a patient or for any common man. Kindly remember, and it's very difficult to remove it, because when we have a follicular units on the backside by naturally, harvestation is so easy because you don't have any fibrosis in this area. When you reimplant it, the grafts are going to be taken up and healed by secondary intention kind of fibrosis. Fibrosis means kind of a skin becomes so tough and you cannot harvest it. Most of the times, out of 100 grafts, if you try to remove it, you would get only 80 to 90 to hand. Others, we need to try second time. This is the one reason very difficult to remove the grafts. Number two reason is, if you keep on removing each and every graft, you're going to make bigger and more holes there. You're damaging the more tissue. So we need to remove few grafts in second session. What I mean to say is, all graft removal may not be possible in single session. That means a repair patient, kindly remember, you need to get second session with the best surgeon, and you need to come for third session also to remove existing grafts. Because if you remove all the grafts in the frontal area in single time, probably it doesn't give you a good look in the skin might get damaged. These are the difficulties we have it. Second difficulty is, you try to harvest the grafts will not come out. That's the how badly handled the skin during the first transplant also makes important note for the surgeon. So these are the few things we'll have technical difficulties while doing the repair transplant. Other challenging factors, like patient wanted full density now, because already burnt his fingers elsewhere in first time and second time you would expect everything best. Now kindly remember, so backside donor is a most plays a most important key role to get best density. If someone is damaged badly your donor, and most of the patient would think that I lost my money. It's not the question of money here, it's a question of your grafts. Your backside grafts have been totally damaged. For us, a good surgeon next time who's supposed to do your correction surgery, probably very difficult task. So not only you are damaging your money, you are damaging your backside donor. This is another challenging point to the good surgeon to repair or correct these kind of surgeries. Well, we are able to manage to remove almost 80%, 80 to 90% of the unnatural grafts in first session itself. Just if you can see 2 months old post-operative, you can see still marks are seen on the forehead. Most of the patient will ask me, would these marks remain forever? Fortunately, it doesn't. 90 to 95% of the marks will fades away with time, and you can see right now 2 months old little marks are seen, I'm sure then most of many of the cases after 10 months, these marks will fades away and nothing to worry about those marks. Yes, we implanted 3,224 grafts first session. That means for him second session it is. So we could get implantation surgery went very well, and we distributed the way we planned it. And after 10 months, it happened to see him with excellent density, very natural hairline, and even the mid scalp density and the crown area. So this is possible with the best hands. Always that is the most important point. You can see the density and it's come out even side angles, front, even top portions. A very satisfactory change within one session. We could achieve it with the best handling the patient, like meticulous way of harvesting the grafts, preserving, implanting, all the steps one by one, and in the best plan. All this happened to carve the best outcome for this patient. We can see very good density, nice blending also. So no one will understand he has done a transplantation now. That's the beauty of the best surgeon hands and selecting the best clinic for the transplantation. Well, you can see the density while combing, as well as even if you spray some water, wet density also, it is very much satisfactory. Why we would like to show the wet densities, that can give you an idea about a density that what we have achieved in one session. Well, last but not least, these densities results always greatly depends on existing donor. So not only surgeon skill and team, but it's also your donor which is very much important to achieve the best density. That's what we need to understand in repair cases. Conclusion and the moral of this story is most of the patients would think that they consider that fine, I'm spending money, I want to do the transplantation. There doesn't end your story. So you need to have a best consultation with your doctor who's operating on you, and you should take few opinions whether I'm a good candidate for doing transplant or what are the best plan you're going to suggest it. Because it doesn't mean that you have seen few videos in different patients. Each patient case is different. Each person has a different question paper, so you can't expect that way. So your surgeon will suggest you what are the suitable options for you. Accordingly, you can modify it. And that's the most important thing. And second point is you're not losing the money in the repair cases. Kindly remember, you are losing your donor. That's most precious. So this donor only a key role for getting the transplant right now, and the future down the line, if you lose more hair also, that donor plays a role. So when someone is harvesting, if they damage, they try to harvest one graft and they damage around this 4 or 5 grafts, then you will not have any donor for the future, as well as the backside looks so bad. Well, when we talk about the any surgeries, including hair transplant surgery, if you go to best surgeon, I'm sure you can't say 100% you get a successful outcome, but there could be failures. But at least the best surgeon who can try to understand before doing a transplant and tell you, warn you, this may not be a good case for you. That's one thing. A second thing is, when someone who is not at all experienced and amateurs, probably you don't get failure transplant, you get wrong transplant. That's the difference between a wrong transplant and a failure transplant. These are the important factors to be considered before you finalize your doctor. Thanks for watching. Thanks so much.